Hello aspirants, welcome to the daily editorial analysis brought to you by Shankar IAS Academy. Today 29th August 2024. Displayed here is a list of articles that we will be discussing. The first editorial article, Breaking a Harmful Pattern. It is taken from the newspaper Indian Express and it comes under GS paper 1. And the second editorial article, Sharpening India's anti-tuberculosis fight. It is taken from the newspaper The Hindu and it comes under GS paper 3. And we will be also discussing relevant UPSC practice mains questions in this session. Before moving into the discussion, we have an important announcement for you. The admission for the pre-storming UPSC Prelims Test Series 2025 is currently open. The first batch will be started on 6th September 2024. The link for the registration is in the description. Do register and attend the test. Like that, Shankar IAS Academy's All India UPSC Mains Open Mock Test 2024 will be conducted soon. Link for the registration is also in the description. Do register and challenge yourself. Without much delay, let's begin with the first article. Breaking a harmful pattern. It is talking about the systemic issues that are leading to increasing rate of violence against women. And in this background, we are going to discuss what are the findings of National Family Health Survey 5 and what are the factors that are contributing to violence against women and what are the key legislative frameworks and initiatives that we have taken to deal with this issue. First, we will start with the National Family Health Survey 5. The survey found that 31% of ever married women between the age group of 15 and 49 are experiencing physical violence, while 7% of them in the same age group are experiencing sexual violence. Coming to the social and economic factors, the survey found that women with lower or no education are highly vulnerable to violence than women with higher education. So here you can see 35% of women with lower or no education are experiencing violence, while 23% of women with higher education are experiencing violence. And the survey found that economic dependence of women is another key reasons for the increasing violence against them. Coming to the pattern of the violence, the survey found that the marital rape or the marital violence are the key issues faced by the women in their relationship. And out of the total cases, 28% of the cases are against their spouses, and out of the 28% cases, only 14 cases are reported and seeking help. Coming to the regional disparities, the survey found that the northern and northeastern states of India have high rates of violence against women than the southern and the western part of India. And the key factor behind this is cultural and socio-economic differences. Now we are going to see what are the causes and contributing factors that are leading to the increasing rate of violence against women. The first major reason is patriarchal norms. That includes the deep-rooted cultural norms that perpetuates male dominance and female subordination in the society. And second important factor is socio-economic factor, like we already saw. Like the economic dependence of women, the poverty, lack of education, unemployment rate are also increasing the risk of violence against women. And the third major reason is the gaps in the legal and institutions, and this affects the enforcement of laws, and it only provides inadequate support to the women and it perpetuates the problem. Coming to the key legislative framework and government initiatives, first we will start with the legislative framework. It includes important acts such as Protection of Women from Domestic Violence Act 2005. It provides legal support and protection to the women experiencing violence in their household. Coming to the Criminal Law Amendment Act 2013, this law strengthens laws against sexual offences including rape and introduced strict punishments. And the third act, it is very important, that is Sexual Harassment of Women at Workplace Act 2013, that addresses sexual harassment in the workplace. Coming to the government initiatives, the first initiative is One Stop Centers. It provides integrated support services for survivors of violence including medical, legal and psychological assistance. Second one is National Commission for Women, and this commission works towards protection and promotion of women's rights including addressing violence against women. And the third major initiative is helplines and support services, that includes 24/7 helplines and counseling services to the survivors of violence. In this discussion, we discussed what are the factors that are contributing to the violence against women, the findings of National Family Health Survey, and the important legislative framework and government initiatives. With this understanding, try to answer this mains question. The question is, discuss the role of societal stereotypes and systemic factors in perpetuating violence against the female caregivers in India. How can communities and education institutions and policy framework work together to address and prevent such violence? This is a 15 marks question and you have to write around 250 words. Try to answer this question and let us move to the next topic. Sharpening India's anti-tuberculosis fight. This article is talking about the intensified India's fight against the tuberculosis, and presently India is all set to introduce the WHO recommended BPALM regime for shorter, safer and more effective treatment for tuberculosis. It can save the treatment costs at the same time patients. In this discussion, we will be discussing the basic facts about the tuberculosis and what are the key initiatives taken in the national and international scenario to deal with this issue and what are the challenges associated with this. First, we will start with the basic question. What is tuberculosis? It is a bacterial infection mainly caused due to Mycobacterium tuberculosis. It primarily affects the lungs but can also spread to other parts of the body. It spreads through air, that is via coughing and sneezing, and also through close contact. India has the highest global TB burden, that is approximately 27% of the global TB cases are reported in India. And in the year 2023 alone, India reported nearly 2.6 million new cases. The biggest concern related to the TB is latent TB infection. It can be also defined as inactive TB, where the infection is present inside a healthy body, but over a period of time, it will become real infection and it can turn a healthy person into TB patient. And coming to the government initiatives, we have National Tuberculosis Elimination Program. Earlier it was known as Revised National Tuberculosis Control Program. It aims to reduce TB incidence and mortality rates. This program is implemented under the Ministry of Health and Family Welfare. Moving to the other key initiatives, we have Directly Observed Treatment Short Course, also known as DOT. It is implemented in the early 90s, and this program ensures adherence to the TB medication by having healthcare workers' observation of patients. And the second initiative is Universal Drug Sensitivity Test that was introduced in the year 2012, and it detects drug-resistant TB strains and allows for tailored treatment strategies. And the third initiative is National Strategic Plan, and it aims to eliminate TB by 2025, which is 5 years ahead of global target of 2030. And the next key initiative is Pradhan Mantri TB Mukt Bharat Abhiyan. It was launched in the year September 2022. This initiative is aiming to mobilize community support, enhance TB services, and provide nutritional support to the infected people. And we also have another key initiative, that is Nikshay Mitra initiative, that allows individuals, organizations, and institutions to adopt tuberculosis patients. This program aims to provide additional support to the infected people that the government cannot provide. And the next initiative is free diagnosis and medications. From early 2000s itself, the government has provided free diagnostic services and medicines to the infected people through public facilities as a part of TB control effort. And the next is public-private partnership and Ayushman integration, that is under the NTPE, that is National Tuberculosis Elimination Program. There is an integration of TB services with the Ayushman Bharat scheme for broader healthcare coverage. Coming to the global initiatives, the first major initiative is World Health Organization's End TB by 2030, which aims to reduce the TB death by 95% and cut new TB cases by 90%. And the second initiative is Global Fund to Fight AIDS, Tuberculosis, and Malaria. This supports TB programs globally with the funding and technical assistance. And the third initiative is Stop TB Partnership, which aims to eradicate TB through advocacy, funding, and innovative approach. And the fourth major initiative is Global Drug Facility, which plays a crucial role in supporting TB control efforts globally. It including India, to ensure high quality TB medicines and diagnostics are available at affordable prices in low and middle income countries. Coming to the challenges in the TB control, first major challenge is drug resistant or multi-drug resistant TB. This refers to TB that does not respond to the powerful first line anti-TB drugs. And this multi-drug resistant TB poses significant treatment challenges because it requires long, more expensive, and less effective treatment regimen. And in the case of India, multi-drug resistant TB is affecting 2 to 3% of new cases and 12 to 15 cases of previously treated case. And the second major challenge is delayed diagnosis. That includes inadequate diagnostic facilities, and awareness can lead to late diagnosis and prolonged infection in the people. And the third major challenge is healthcare infrastructure. That includes limited resources and infrastructure in rural and underserved areas that impacts the TB control efforts. And the fourth major challenge is socio-economic factors. That includes poverty, malnutrition, poor living condition. This can increase the risk of TB. Now we are going to see the recent developments in the fight against TB. The first recent development is new diagnostic tool such as Gen Expert. This have improved early detection and reduced the time to diagnose drug-resistant TB. And the second major initiative is AI tools such as mHealth app. It was launched by WHO in the year 2005 in India for counseling, reminders, and free treatment for TB. And the next initiative is vaccine research. That is ongoing research into new vaccines such as TB vaccine candidate M72 AS01E. This aims to provide better protection against the infection. And the next recent development is integration with the other healthcare services, which includes effort to integrate TB services with other healthcare programs such as HIV care to improve overall health of the people. Now we are going to see the socio-economic impact of the tuberculosis. The first impact is healthcare burden. That is, the TB needs long-term treatment. This will increase the burden on health system. And the second one is economic cost of the treatment, low productivity, and particularly in low income setting can impact the economic status of the people. Next important impact will be social stigma. This can affect the mental health of the people, especially children and women. And the next impact will be TB mortality. TB is among the top 10 causes of death in India according to the WHO in 2023. And TB is also associated with the co-infections such as HIV, diabetes, and this can impact the efforts to control the TB and also intensify these conditions like HIV and diabetes. Coming to the conclusion, India ranks first in the World Health Organization's list of high TB burden countries, but the country is making comprehensive strategies and policy initiatives aimed at reducing TB incidence and mortality. But it is also facing challenges such as drug-resistant TB, limited healthcare infrastructure, and other socio-economic factors. With this, we are coming to the conclusion for the discussion and for editorial analysis. With the understanding, try to answer this main question, that is, the question is, tuberculosis is still a big problem in India. Support your answers with valid reports and discuss various reasons for this. Give some solutions to tackle this problem. This is a 15 marks question and you have to write around 250. Try to answer this question. Thank you. Have a nice day. With this, we are coming to the conclusion for today's editorial analysis. If you like the video, hit the like and also give your feedbacks as comment and also share the content with your friends to make the competition more healthy. And before leaving this channel, don't forget to subscribe and also hit the bell icon to receive on-time update from the Shankar IAS Academy. Thank you. Have a nice day.